Thank you for joining us today. We're going to have two experts from UAB here to talk about testing and the state of COVID-19 in Alabama. The first is going to be Jordan DeMoss. He is the Vice President for Clinical Operations at UAB Medicine, and he'll be addressing testing in our community and expansion of testing in Birmingham. And then next we'll have Dr. Rachael Lee. She's UAB Hospital's epidemiologist, who will discuss the state of COVID-19 in Alabama and can take questions you may have in general terms related to that. We're going to open it up for questions when Jordan finishes his comments. Any questions you have for him, please ask at that time. And then when Dr. Lee comes up, direct questions to her. Thank you.
Good afternoon. We are really excited to be able to report that since we started all of our testing journey here at UAB, we've been able to test over 5,000 people at our downtown testing site. So we've been spending the last month really making sure that we provide access to the community at that site and building our capacity internally at UAB. Thanks to Dr. George Netto as chair of the Department of Pathology and Hospital Labs, we've made a lot of strides in providing more testing to our community and building our capacity at UAB. So today I'm excited to announce that in partnership with the Unified Incident Command Center, that we're able to start providing mobile testing out into our communities. This will be a new venture for us and something that we're excited about doing. We know that not all patients and not all citizens in Birmingham and Jefferson County want to or can come to a mobile or to a downtown drive-through testing site. So we want to be able to go to them and meet them in their communities where they are. This week we'll start in two locations. We'll start in our Bush Hills community at Central Park Christian School, and then later in the week at Centerpoint at Cathedral of the Cross. This will be a new opportunity for us and something that we will want to learn from. Our drive-through site has been unique in that patients come to us and we have a lot of efficiency built in there. Going out into the community will be a little bit different, so we appreciate everyone as you give us the opportunity to work through the details and expand this out into even more communities in the upcoming weeks. The communities we'll be going into, we'll see yard signs and different promotions in their communities, so we're doing some focused reach out into those communities. There's a unique number that you can call to get information about where we will be and when we will be and how to make an appointment. That number is 975-CV19. We have experts on the line that will help not only get you an appointment, but also talk to you about what COVID is and what types of symptoms we're looking for to be sure that we're testing the right people in your community. So this is exciting for us. We're glad that we've been able to really build our capacity and to be able to expand this into our community. I'll be happy to take any questions.
Great. The line is open. If anybody has a question for Jordan, you can ask it now.
This is Morgan with Fox 6. How are you determining what communities would be best for the mobile testing?
So, there are a lot of great opportunities across the county, and we hope to get to all of them. Right now, we're leveraging partnerships that we already have through our Unified Incident Command Center, and also those partnerships we have here at UAB through our Minority Health and Research Center. So we have lots of partnerships and lots of community partners who can help us get to the right places in those communities. We've also looked at our own data internally of all the tests we've done here at UAB, and we're trying to align where we see a higher incidence of COVID positive rates with our first steps into those communities.
Thanks, Morgan. Does anybody else have a question for Jordan?
Question.
Yes,
Sorry, go ahead.
This is Cynthia at ABC 3340. Hey, could you address the questions about false negatives with any of these tests? Are they 100% accurate? I would assume not. What do you tell people even if they get a negative about still being careful in the community?
So all of our tests that we are using here at UAB are all validated tests. We feel confident that they're of the best quality. Certainly not any test is 100% accurate. And so if a patient still continues to have symptoms and they test negative, I would encourage them again, to contact their care provider, their primary care physician if they have one. And certainly at our site here at UAB, you can call back to our call center and provide your symptoms and walk back through those with our call center nurses and clinicians, and we can certainly test again.
Thanks, Cynthia. I think there was someone else who had asked a question. You can go now.
Yeah, this is Hank Black with Birmingham Watch. I'm curious about whether this is at these initial clinics or their interpreters, Spanish interpreters, and if not, when will those mobile sites be identified and rolled out?
We've been working very closely with HICA and also with Jean Hernandez from AIDS Alabama to really look at how we provide support for our Latino community across Jefferson County. So our goal is through this unique call center, the 975-CV19, that we will be able to identify those Jefferson County residents who do not speak English and who need interpretation, primarily Spanish, but really any interpretation, and really working to provide an on-site interpreter for those patients that do when they come on site through different resources that we have both here at UAB and in the community.
Hi.
Yes.
Hi, Miranda Fulmore with WBHM. Can you tell me a little bit more as you expand this new mobile testing throughout Jefferson County? How many more tests do you guys think that you're going to be able to achieve on a daily basis?
You know, we really don't know what the demand is when we go out to these sites. So we expect that we'll learn a lot this week as we get started, and certainly we'll be willing to go back into communities where we see more demand than perhaps what we're ready to provide on our first days out. Right now, we're going out with the expectation of somewhere between 50 and 100 patients per day. We hope that's what we get to. But we've talked about getting to 20 patients in our first week at each site as a success. Our goal is simply to expand testing and to expand capacity out into the community to get tested in places where it might be a little bit harder to come to a downtown site or by car.
Is there another question?
Yes, this is Nick Patterson with Birmingham Watch, and I have a question about exactly the form or the format, the shape of these testing facilities, the testing mobile facilities that you're going to roll out. What will that look like?
You know, we wish that we could answer that completely. We don't know the exact details until we find out, but what we're planning is to go out with a smaller, really a small profile, a smaller group than what we have at our downtown testing site. And to make it very accessible and simple, meaning that there'll be a few people. It won't be high profile. We won't have big tents set up. We really want to make this really comfortable for the community. So we do anticipate that we'll use both drive up and walk up at some point. This week we're going to test the drive up at these sites with the anticipation of doing walk ups in the following week. Our major goal at all of these sites is safety for both our clinicians and the patients, so we really have to work through the logistics and work closely on keeping the care sites safe.
Just a reminder before someone asks another question, please mute your line if you're not speaking, and once you've asked a question, please mute your line. Is there another question for Jordan?
Yes, hi, this is Ian with Channel 13. I know last week we learned about some of the financial issues, the $70 million or so a month that UAB was losing throughout this. Just wondering if that's impacting the testing or impacting anything that you're doing, and if so, if you could kind of talk through that.
It is not impacting the testing. Testing has been something that's been evolving daily, really, both obviously at the nationwide perspective and here locally. The biggest barrier to testing has been access to the supplies, both the swabs and the reagents, and then certainly the platforms that run the tests. So financial barriers have not been an issue with expanding testing. It's really been access to those key supplies that are needed to expand testing out into our communities.
Thanks, Ian. Is there another question?
I have another question, but I've already asked one. Is that okay?
Sure.
Okay, this is Morgan with Fox 6 again. There was a study that was released a couple weeks ago by Harvard University kind of predicting how many tests were needed in each state to get an accurate reading of what the virus is doing here. And I believe it was saying there's 11,000 tests needed per day in Alabama. Have you guys done anything similar to estimate how many tests are needed before we can really talk about reopening businesses, or until we can have a really good gauge of how many people in our state are actually infected with this virus?
I'd have to defer to our public health experts on the question of how many tests. I can only answer that, here at UAB, we've expanded really from when we started testing from about 100 tests per day to now up to about the capacity for 600 per day. We still don't think that's enough, and so we have plans to continue to expand that capacity over the next month and months ahead.
I think there was somebody who tried to ask a question when Morgan did. You're welcome to ask that now.
Okay, yep, that was me, Nick with Birmingham Watch. Just wondering then if you can kind of articulate why it's so important to get out into the communities again with these mobile testing sites.
Well, I think we realize that not every patient, not every citizen in our county does or can or will come downtown to a site through a drive-through site, and that it might be intimidating for someone to have to call a call center and go through a whole algorithm with unfamiliar faces and folks on the phone. So we feel like being out and being present shows both support to the communities who may not feel comfortable coming downtown, and it also gives us an opportunity not only to test, but more importantly to educate and to help connect with resources in those communities. So I think as we begin to reopen our communities, it's going to be important that this continues as an ongoing basis. Again, not only to test, but to create awareness and to create overall access and trust in the healthcare system.
Are there any other questions for Jordan?
Hi, yes. Just one more quick question, Miranda Fulmer, WBHM. Can you just reiterate, it's starting this week and the first couple communities you're going to, just so I have it correct?
Yeah, this week we will be going out to the Bush Hills community on Thursday from 1 to 3 at Central Park Christian School. And then Friday our plan is to be at Cathedral of the Cross and Center Point from 1 to 3. We will begin the promotions in those communities this week. They've actually already begun. You will see some of the yard signs and different promotions there. And then our call center went live over the weekend, 975-CV19.
And that's also 975-2819. Any other questions for Jordan? One question we've gotten from Facebook, how long do you anticipate the downtown site being open?
We see no end right now to the downtown site. When we opened it, we got that same question, and we said we would just continue to be there and to be accessible until we felt that resource was no longer needed. So we will be there. There is no end date currently.
Okay, if there are no further questions for Jordan, we're going to bring up Rachael Lee, who's the UAB Hospital epidemiologist. One moment. And she's going to provide an update on the state of COVID in Alabama.
So to start off, just to let you know, worldwide we are over 3 million cases with over 200,000 deaths. As you look at United States, we are nearing 1 million cases and over 55,000 deaths. And then if you look at Alabama, we have about over, I believe, or close to 6,500 cases. If you look at the case number per day, it appears to be slowing, which is a good sign for Alabama that we aren't seeing that high rise of cases like we were before. There are a fair amount of patients that are still hospitalized and in intensive care units throughout our state. And I think the efforts that we have done in terms of social distancing and stay-at-home orders through Governor Ivey have really been essential for protecting our citizens and preventing the spread. What Jordan has been talking about in terms of testing is really important for infection prevention. What we know is that the faster you can test and get an answer, the faster you can contain. And so what UAB has done, we have tested over 10,000 people for COVID-19, which is an incredible feat in such a short period of time. But as everyone has been saying, that's not enough, and that data is based on what that Harvard paper said, that what you want is the number of tests that you have and the percent that is positive is less than 10%. So if you look at what happened in March, our rates were close to 20% in terms of our positivity. And those numbers, at least from a UAB standpoint, have gone down to about 9% for people that are symptomatic and getting a test. So we're getting there, but what we know is exactly what Jordan has been saying, which is we only can test what's currently in our hospital, but there are many patients and people that can't get access to those tests. And so being able to deliver that test platform to them is incredibly important for knowing what's going on in the community and containing the spread of COVID-19. In terms of, I know that there are probably going to be questions about opening the state back up, and a lot of it is dependent on testing because of that model of being able to contain as much as we can. But we have to remind ourselves that we are likely going to be entering a new normal. And what that means is we are going to be wearing universal masks. When you come into the healthcare system, you will need to be wearing your mask because Joint Commission, which is something that all hospitals follow, is recommending that all visitors, patients, and healthcare workers wear masks. We know that hand hygiene is incredibly important, and to think through how we can continue to do hand hygiene as we go out into the community. And then lastly, social distancing. So we are all very close-knit community, and so we have to take a step back and think through what is the best way to continue to be that loving community, but also to be safe. I'll open up right now to any further questions or comments that you may have.
If anybody has a question for Dr. Lee, you can ask it now. Is there a question for Dr. Lee?
Well, this is my friend.
Sorry?
With Birmingham Watch, can we, did I miss, I had a little hard time hearing this, but is there a breakdown on what, who UAB has tested as far as African American, white, Latino, that kind of thing, demographically?
I don't, so the question is about demographics for our testing. I do not have the demographics. What I can tell you is that any patient that is coming into our healthcare system is being tested universally for COVID-19, regardless of symptoms. So it is irrespective of race, ethnicity, or anything like that.
Is there another question for Dr. Lee?
Hi, Dr. Lee. This is Ian Rice with Channel 13. I wondered if you could speak to the CDC's recent addition of new symptoms for the existing list of COVID-19 symptoms and how that relates to what you're seeing here in Alabama.
So, yeah, the new symptoms that they included, so they still had fever, cough, and shortness of breath, but some of the other symptoms are what we call a viral prodrome, so headache, nausea, fatigue. Those are some of those very non-specific symptoms, and they recognize that a lot of patients have had that viral prodrome before developing a fever or before developing that cough. I've talked with Jordan about how do we expand testing in our community through our drive-through site while including some of these symptoms. And we have to be careful because if we say just headache alone and no other symptom, it's hard to tease out if that's truly related to a new viral illness versus maybe some other cause for a headache. I think as we continue to ramp up our testing, and what Jordan was talking about, the thing that limits us the most are the platforms to perform those tests, the number of swabs that we get. Jordan and his team are constantly calling for more swabs and more reagents in order to test that. If we could test all patients regardless of their symptoms, we would, but that's what limits us the most.
And just a reminder to mute your line if you are not speaking. Does somebody have a question for Dr. Lee?
Dr. Lee, this is Morgan Hightower with Fox 6. Just a quick question about social distancing. You know, the expectation is sometime this week the governor is going to reopen businesses in some manner, and social distancing and personal responsibility is going to be very, very important. However, do you believe people in Alabama are going to be able to maintain social distancing if they're not forced by a state order or a county order to stay away from others?
That's a great question. I think what we have learned about this pandemic is that we are all very much aware, and to continuing to do press conferences like this and getting out information, accurate information in the media like y'all have been doing is very, very important. I think we continue to follow some of the models that the grocery stores have implemented, including having and making sure people are wearing masks and going in one particular direction. I think that's what we can do as a community, and if you're a small business owner, to look through your area and determine what is best for the flow while still allowing people to come in. I wish I had an answer, a blanket statement that we could all do one thing one way, but it's not that simple because we are all unique in our spaces and in our areas. The same thing goes for hospital systems. So if you look at waiting areas, you have to think through what is a better way to set up this waiting area than how we had it before. Can we continue to do telehealth for people that are otherwise healthy and maybe just need lab work? So those are the things that from high up level in the hospital system we're thinking about, and it should go all the way down for every individual community. Hopefully we don't lose our guard with this because we are concerned that we may see a second wave. And as summer comes and we're all wanting to go on vacation, trust me, I want a vacation and I completely understand that. We have to think through what is safe and careful for our family and our community.
Does anybody else have a question for Dr. Lee?
Yes, Dr. Lee, this is Henry Thornton with Yellowhammer News. As part of a lot of the sort of opening up Alabama, theories advanced by various politicians, a big part of them, as has been said before, is a big ramp up in testing capacity. It's something a lot of people are calling for, and you've spoken a little bit about it. What I want to know is, do you think the most likely way that Alabama can meet this expanded capacity that everyone wants is with a ramp up of the existing testing technologies, or do you think that ultimately some of these testing methods that people are working on developing, such as the sensor method being worked on at Auburn or some of the rapid antibody tests, do you think, in short, we'll have to have new types of tests to meet the total demand for testing capacity?
Yeah, that's a great question. So to take a step back, how do I determine if someone has an infectious disease that can be transmissible? So with viruses, the number one way is the PCR, because what that tells me is that there is virus that I can detect on that swab. There's another test called an antigen test, and I believe Dr. Birx mentioned that at the last press briefing. And I'm not sure of the test capabilities of those, but what we do know typically about antigen testing is they are not as sensitive as the PCR tests. And then lastly, the antibody test. And what an antibody test tells us is whether or not you've been exposed to this virus. Now, what we don't know and what the WHO pushed out is if you have a positive antibody, does that mean that you are protected for life for COVID-19? And we do not have the studies to say that you're protected for life. All that we can say is that, yes, you have antibodies that are detected, and there may be some cross-reactivity with some of these other common coronaviruses, but we just don't know yet if it's enough to say if I had positive antibodies that I could safely go in and take care of a patient that has COVID-19 without wearing the personal protective equipment that is required. And so we have to be very, very careful with those antibody tests in terms of how we interpret them.
Is there another question for Dr. Lee?
I have a question.
Hi.
This is Nick Patterson from Birmingham Watch. Dr. Lee, do you think you can give a thought as to whether or not we are ready to open the state, given the number of tests that we have, and even the number of tests that we will be having in the foreseeable future because of the mobile testing?
So that is a very hard question to answer. I think that in certain areas, so if you look at Jefferson County, our rates have gone down significantly, but they're not zero. We are still continuing to see new cases of COVID-19 every single day. So if we open up too soon and there's still new cases circulating even when we have stay-at-home orders, then that could potentially go up. And so if you don't have enough testing, then you cannot keep that under control. What I think is potentially possible is that we may be able to slowly open up certain areas where we can have people come in as long as they're big enough spaces. And that's where we have to continue having that social distancing. You know, bars and restaurants, they tend to have very close quarters, and so that's where having restaurants look through their spaces and figure out, can we have this in a safe way to bring people back? I personally think that we still need more testing in other parts of Alabama to be able to truly say as a state that we can open up safely.
Are there any other questions?
Hi, Dr. Lee. Yes. It's Miranda Fulmore with WBHM. I just wanted to throw out a question more about rural areas and testing in those areas. I know that there's been a lack of testing, especially among rural areas. There's blackouts. You know, what are some of the bigger concerns there? And, you know, could there possibly be cases they're building that just won't come across on the radar until it's too late? Can you just talk a little bit more about that as well?
Right. I mean, I think that's what we saw with, Lee County is a smaller county, and they had a large number of cases that occurred very quickly, so that potentially an outbreak that occurred, and that's why their case numbers are so high compared to, say, Jefferson County. And I think what triggers ADPH, Alabama Department of Public Health, to go in there is having key healthcare professionals being able to tell them to come in. And so I know I've talked with Dr. Landers at ADPH, and they are working on making sure they have this rapid PCR test available for these rural areas, which is very important, because if you can give someone an answer within 15 minutes of getting that test, yes or no, you do or do not have COVID-19, that gives you an idea of what's going on in that community very quickly, and then B, that gives them information to those loved ones, so then we can do more what we call ring testing, meaning if I were positive, they would test my family or other people that were close to me to know if they have been exposed or if they have symptoms of COVID-19.
Does anybody else have a question for Dr. Lee?
Hi, yes, it's Cynthia at ABC 3340. Can you give some further clarification on the issue of masks? People going to the grocery stores and places like that, do you think everyone should be wearing a mask, employees and customers included?
So what we know about masks is mainly based on data from studies about flu and those sorts of things. So if someone is sick, we put a mask on them, and that prevents the spread of that virus and those droplet particles. What we don't know about COVID-19 is how many people are walking around in the community that may have that virus that's detectable in their nose, but may be asymptomatic. And so the thought process behind wearing masks, everyone, including myself, is to protect as many people as possible from that virus from spreading. So if everyone wears some masks, then that reduces the amount of virus in our community. I highly recommend wearing masks in the community for the foreseeable future. I know that Joint Commission has recommended it for all hospital systems, and so we are going to make sure that we have the language out to remind patients and the visitors that are coming in to see those patients to wear their cloth masks or whatever masks they have from home when they're coming into our facility. And the same thing for our healthcare workers, to continue to wear masks throughout our healthcare facilities.
Does anybody else have another question for Dr. Lee?
Hey there, actually one more question, and whether that is, Jordan that can answer it or Dr. Lee, and this, I just want to clarify, just to make sure we have it right. Do you guys have an idea of how many mobile testing sites you guys are planning to have? Has there been a collective number you guys are hoping for, different areas of Jefferson County to visit?
I'm going to bring Jordan up here to answer that.
There's no specific number. Again, we're working really closely on coordinating all of this through the Unified Incident Command Center, and that is really where we will be directed on where to go in our communities. So I don't think there's any limit on the number of areas we will go. We will continue to respond to the demand and go to where we feel that there's need.
Does anybody else have a question for Jordan while he's up at the podium? If not, we'll bring Dr. Lee back up. Okay, I think we'll bring Dr. Lee back up if anybody has another question for her. And if not, we'll take some questions from Facebook. Okay, I'm going to mute the call line. We have a few questions from Facebook, Dr. Lee. One of the first is, if I've been in contact with someone who was positive, but it's been more than 14 days and I have no symptoms, am I okay to be around other people and continue my life as normal?
Yes, you are okay to be around other people. What we know is that most people will have symptoms by 5 days, 95%, and then about 99% will have symptoms by 7 days. Then there's just a very small number of people that may have symptoms from that 7 to 14-day period. So you are out of the window of exposure, and yes, you can go be around your loved ones.
Another question, when will family members be able to visit patients in hospitals again?
So I know that there was there's been a big discussion around hospitals in Jefferson County, and I think for right now, until we know more about what Governor Ivey is going to recommend in terms of opening up the state, we are going to continue to limit our visitors into our healthcare system, mainly because that allows us to control what's coming in and out of our facility in terms of prevention of the spread of COVID-19. I think as we know more about and we continue to get more testing up and running, that will be really helpful to be able to open it up and come back to a more normalcy of our institution and our operations.
Another question someone had was about transplant recipients, which I think can go to immunocompromised patients in general, but nobody speaks about this group, and I'm worried that we're unable to obtain N95 masks, and we have to be out at times for lab work and doctor's appointments more than others. What precautions do transplant recipients need to be taking?
So I think a lot of work has already been done for transplant recipients. I've talked with a lot of the bone marrow transplant physicians here, and because we are used to telling people to wear the procedural masks, those droplet masks, when they're going out around town, actually the number of cases in this group has been fairly low, at least at UAB. In addition, the N95 respirators are actually fit tested to your face, and they're really meant for healthcare workers, and particularly healthcare workers that are performing what we call aerosol generating procedures, which are when you're intubating a patient or when you're performing what's called a bronchoscopy, which is taking a camera and looking down the lungs. So those, we really want to reserve using N95 respirators for that group. If you are a transplant recipient, you can wear a procedural mask, which is going to be your standard surgical mask, that's what they're known as, and you should be safe. Just continue hand hygiene and to be careful when you go out in public.
Another question is somebody, and I don't know if it was touched on by either of you, but that there could be a second wave in the fall. Can you just talk about what a second surge could look like if we don't keep social distancing, wearing a mask, avoiding crowds and such now?
Right, so what a second surge means is because we are unsure about the term herd immunity, which means that we have enough people that have enough of their immune system because they've been exposed to COVID-19, and we really have no idea in terms of COVID-19 if there is any herd immunity. But because we don't know, the potential is as we get back together into groups and continue to socialize in the way that we used to socialize, we will see a second surge of cases, particularly in the fall, which is when we commonly see coronaviruses. So that is the main concern there.
Another question is about masks and what constitutes an appropriate mask and one that could protect somebody. Could you wear a bandana? Do you have to wear an N95, a cloth mask? What's your take on masking for those in the community?
In terms of the community, I think an N95 respirator should be reserved for healthcare workers that are in hospitals. We are currently seeing a large amount of shortage of those, so if we can reserve those for healthcare workers, that's incredibly important. And then for any mask that you have going forward, you know, I have a cloth mask when I go out into the public. I think that we don't know if that protects you, but it should protect you because it has layers. And you aren't sick, and then hopefully people that are walking around in these areas are not sick and coughing. And so therefore, it should be protective. In terms of bandana and other, like there's a t-shirt, how to make a t-shirt mask on CDC. I think they all are equivalent in terms of how they provide protection.
And you may not know the answer to this, but I just know some people are concerned. Do they have to clean their mask, or how can you provide any tips or any information on what they can do if they have to keep re-wearing the same masks?
So the biggest issue is in these manufactured masks is if they become wet, they may not work in terms of filtering out pathogens. With the cloth mask, I would recommend washing them once a day, or having a couple that you can go through and then washing them at the end of the week in order to protect yourself. And then also, there are some great guidelines of how to care for your mask when you go to the bathroom or when you're eating, and I think UAB is going to work on some more guidance in terms of that as well. Just to remind you that you can put it into a bag, or make sure you don't take it into the bathroom with you because you want to keep it as clean as possible.
Are there any other questions from media on the line? Okay. I think that is going to be it, Dr. Lee. I'll let you come off. Oh, and I'll go over. Thank you again for joining us today. Just a reminder, like Jordan mentioned, the call center line for the new mobile testing is 975-2819. So that's 975-CV19. Please continue to visit uab.edu/coronavirus for up-to-date information.